Good morning, everybody. My name is Erica Jimison. I am joining you from Easterseals, Colorado, and the Colorado Respite Coalition. On behalf of JFK Partners and the Colorado Respite Coalition, I welcome everybody to the second in a four-part webinar series that we're holding on understanding challenging behaviors in respite care. Today we'll be talking about understanding challenging behaviors in adolescents and young adults. We have about 120 people registered, with most people joining us by webinar link. We're recording today's event. It will be available on the JFK Partners website, on the Colorado Respite Coalition website, along with some handouts, a copy of all the slides, and a discussion and behavior guide if people would like to take this back to their respite agencies to use it there as part of a group training. Web participants can please ask questions via your chat box. And for people here in the room, welcome to ask questions whenever, and people on the web will pass those along. And for those of you here in the room, we'll bring around a microphone also for questions. So now on to our wonderful speakers. Thank them both for being here today. Jamie Burstein is a doctoral candidate in the clinical psychology PhD program at Northwestern University Feinberg School of Medicine. Jamie is currently a psychology intern at JFK Partners. Over the years, Jamie has worked as an ABA therapist, paraprofessional, behavioral interventionist, as well as a childcare attendant and peer mentor for individuals with intellectual and developmental disabilities. Jamie is also passionate about conducting research to inform clinical interventions for individuals with neurodevelopmental disabilities, and received a National Science Foundation Graduate Research Fellowship to conduct research. Jamie's experience with diagnostic evaluations and interventions, along with her passion for working with individuals with behavioral challenges, is what brings her here today. Lindsay DeVries, PhD, is in her second year as a postdoctoral fellow at JFK Partners. Lindsay has received specialized training working with children, adolescents, and adults with developmental, socio-emotional disabilities and physical impairments in a wide variety of clinical settings, including hospitals, schools, in-home therapy, and outpatient treatment facilities using an evidence-based interventions. In addition to coursework and formalized training experiences, Lindsay is a sibling to a brother with autism spectrum disorder and has been involved in research, trainings, teaching courses, and engaging in outreach work relevant to individuals with disabilities and their families. Lindsay's professional blended with her personal experience as a sibling will bring unique perspectives to this webinar topic. Thanks very much.
Thank you, Erica, for the warm welcome. So we're just going to go ahead and jump right into it. So Erica already gave us a wonderful welcome and explained a little bit about our backgrounds and who we are. This is just some screenshots of us so that you guys can see us on the web if you can't see us from the camera right now. Really, this presentation, we're hoping to cover a lot of bases discussing behavior and how it might look different when you have an adolescent or a young adult, and the context for which that can change based on working with maybe a child or an older adult with similar needs. We also want to think about how we can support respite providers as well as families in managing challenging conversations regarding behavior, particularly around sexuality and appropriate social relationships with others. Additionally, we think that it's really important to think about some of these behaviors in the context of law enforcement and society, and that's something that unfortunately comes up quite often with this population. And so we have some thoughts that we're hoping that we can share with you all in relation to that. A lot of our presentation is also going to be focused on how to better develop communication strategies with families and have a plan in place so that if a crisis does emerge, you feel well prepared in handling that and dealing with it and moving forward. And then lastly, thinking about tactics to prevent and de-escalate challenging behaviors in case those plans go out the window and you need some tools to try to keep yourself as well as the recipient that you're working with safe. Anything you'd add?
No, and I will add that we did receive questions that people submitted, so we really appreciate that and hope to address those questions over the course of the talk. If you have any questions as we go, though, please feel free. You guys can ask, or those of you on the web to chat in, and we'll address those as we go. So we want to start by talking about common challenging behaviors that we might see in adolescents and adults with intellectual and developmental disabilities or developmental disabilities. So you'll see IDD, DD frequently, and that's the population that we're referring to. So we might see behaviors such as elopement, so, running away, leaving home, physical escalation, so hitting, biting, or property destruction. You might hear this called aggression. And we want to, for the purpose of this talk, really think about this as a physical escalation rather than calling it an aggressive behavior. Also self-injurious behaviors, so whether it's head banging, scratching, biting, that might be something that we commonly see. Any risky behaviors, so behaviors that are putting them at risk either for sexual abuse, physical abuse, sexual misconduct, theft, substance use, any health concerns, and I'm sure that there are others that other providers might think of as well. And so these are some of the behaviors that we're going to talk about addressing today. We also know that adolescence and early adulthood is a very fun age, and there's other things that are occurring at this age too, right? So in addition to hormonal changes, differences in social structure, we're also seeing within this age that there's changes in service providers. So maybe they've been seeing the same individual throughout childhood, and then they have to make the switch when they turn 18. And that's a real challenge for a lot of individuals, especially a lot of individuals who have difficulty with change. We also see transitions from school to other settings. So as you know, most of these individuals can stay in the school system until 21. And then maybe they're going to a residential facility, a day program, work setting. Also, like I mentioned, there's physical changes happening to the body. There's also a change in the services that are available. So maybe there were services through school. There's a lot more services for children than there are for adolescents and young adults. Different expectations for what they should be doing recreationally, for leisure, changes in relationships, and then also their parents are aging as well, right? So that's a huge thing we think about for this population. It's great that we've had advancements in medical care, but that is resulting in a lot of kids outliving their parents. And so we have to really think about what does that transition look like and what kind of supports can we put in place.
And one thing that I'll add too is that I think that one of the things that may not occur to people when they're working with this population in particular is that even though this individual, the individual recipient may be having a different trajectory for how they're transitioning into that role of adulthood from adolescence, they're still connected probably with peers and siblings that have a much more typical trajectory. And sometimes that can be really challenging at that time. And so in the general population, we often see higher rates of anxiety and depression for adolescents and young adults. And this population is no different. And so I've seen personally several patients through our clinic who have been teenagers with intellectual or developmental disabilities where they've had big behavioral changes since they've had their graduation ceremony for high school. And part of our conceptualization of how to help that individual is that that's a really big event and their peers are just kind of gone at that point, and trying to wrap your head around what does this mean in my new role within the context of the school or within the context of my job is something that can be really jarring and difficult to explain to somebody that maybe has a developmental disability or an intellectual disability.
And if you think about, too, going off of that, many of the young adults I've worked with, losing that structure is really challenging for them. And so within the school system, there's even a structure around social relationships. So you see your peers in class, you see your peers in extracurricular activities, and then you kind of go to this more unstructured, even, within the workplace, it's challenging for anyone, but that transition can be particularly difficult if you have an intellectual or developmental disability. Difficulty with social relationships. So when we think about challenging behaviors, and really when we think about any behavior, we conceptualize this, and the framework that we want you to take, and I believe some of you may have been present for last webinar and gotten some of this information, is that every behavior we see serves a function and has meaning to the individual. So we like to really focus on looking at that behavior not in isolation, but in context for what's going on. And so rather than focusing too much on what do you do when you see the behavior, we want to think about what does that behavior mean, and how can we shape the environment and put supports in place to maybe prevent that behavior from even occurring in the first place. So this was a review from the last webinar, but I think always good to go over again as we think of ABCs of behavior. So again, every behavior does not occur in isolation. There's an antecedent, so there's something preceding the event, and there's a consequence, something following the event. And so we want to think about each behavior as what happened before and what was the consequence. And so there could be an event that stimulates a desirable behavior leading to a desirable behavior. And then we think about, well, what reinforces that? What supports that and makes it continue to occur? And then the opposite, right? So there might be an event that stimulates an undesirable behavior. And then we want to think also about what's supporting and reinforcing that behavior. Is there a reason we're seeing this occur over and over again? Because maybe it's being reinforced even if we don't realize that we're reinforcing it. So examples of how we might conceptualize escalated behavior is one of the biggest things is communication. So an individual who has difficulty with verbal communication might use physical behavior or what we would see as a challenging, escalating physical behavior, because that's the only way that they can communicate and get their needs met. So we see this quite frequently in little kids, younger kids who maybe especially have difficulty with expressive language. And so it's not that different if we want to think about that. If you don't have the language to say, no, stop, I don't want to do that, it might turn into a hit or a scratch.
And one thing that I'll add is even if you have somebody that's highly verbal and has great expressive language abilities, that doesn't mean that their behavior isn't communicating something.
Exactly.
All behavior functions within the context of communication. But if you think about it, if I hit or scratch or bite and it gets my message across really quickly, that's a pretty cool way of getting the thing that I don't want to happen.
Mm-hmm.
And so it may not be desirable and it may not be the way that we want that behavior to occur, but it is a very quick and efficient way for that individual to communicate, whereas it may be much more challenging to try and find another way that is going to get the message across as strongly or as quickly.
Mm-hmm. Right. And so that points to that addresses the next point of if this behavior has been reinforced in the past and it's gotten attention or it's worked, then that might be why it's occurring again. And I'm really glad that Lindsay brought up that point that we don't just see this in individuals who have difficulty with verbal communication, but sometimes it is much easier. Maybe the regulating piece is difficult for them. So managing feeling angry. And so their first reaction is to show a behavior rather than sit down and say, oh, I'm feeling really angry right now. I mean, that's not easy for any of us to do. And then you add these added components of difficulty managing those emotions. And maybe that's why we're seeing it.
And then just another quick thing that I'll add is that even though you can detect some patterns within these behaviors. It's important to realize that individuals escalating may still differ and be specific across situations and contexts and people. Oftentimes, it's really challenging to figure out why a behavior is occurring and how to shape it or address it in a way that's going to be productive for the individual. And one thing that we'll talk about as well is that even though these behaviors are very challenging, it's really important to maintain respect and dignity for that individual. And oftentimes we see these behaviors that, like Jamie said, might be more typical in younger children, but we're dealing with adolescents and young adults, and it's important to remember that when working with these individuals, that these individuals, even if their cognitive abilities or their skill sets may not match their chronological age, are still adults and young adolescents and should be treated as such. It's just sometimes tricky to figure out how to find the best fit so that you can support them while also treating them as such. So we have a quick example to go through. This is just a case example of maybe a difficult behavior that some of you have encountered or maybe not. So it says that Sharon requests to go out for coffee, but her staff inform her that she does not have enough money to do so today. Sharon responds by scratching herself, yelling at the staff, and throwing objects at them. The staff leaves the room and closes the door.
Does this sound familiar to anyone?
I see a few smiles of the people in the room. So we're going to think about the ABCs. So when you see a behavior, asking yourself, what is the purpose and what is the consequence? So when we think about the antecedent, the setting event to that behavior, what was it that we saw that occurred first? What was kind of the precipitant to that behavior that we saw from Sharon? We could tell you guys too.
Those of you who are live in here, you have the disadvantage of having to answer questions. Unless someone has an answer on.
So she was denied access to a fun event, right? She was told that she didn't have enough money to go out for coffee. And so the behaviors that we saw then were scratching, yelling, throwing items at staff. And then the consequence of that was that her staff member left. And so we'll revisit this, but this is just kind of a way to think about how to apply the ABCs to an actual behavior that you might see in the context of the people that you support and work with. So first things first, we're big on having a plan, and sometimes the plans go out the window, but oftentimes having a great safety plan with the family and the participant and having an idea of how to support them goes a long way. So these are just some questions or some things that could be helpful for people that are respite providers or people that will be supporting an individual to think about asking the family and to think about getting more information about. Many of these things you may already do, and some of them you might not have thought about before. One in particular that I've gotten feedback about that families are like, wow, I've never thought about that, is thinking about doing drills at home regarding fire or tornado or a break-in and how that individual would respond. If they're outside of the school system, they're probably no longer getting that practice of doing a drill, and they may not have done drills in their actual home to know where to go or how to respond in those situations. So that's just one example of some of the questions that can be helpful as well. I think another thing that can be helpful is thinking about if you feel like you need additional training in de-escalation techniques or strategies for managing difficult behaviors. Thinking about what trainings might be recommended to you by the family or the organization that you're with, and whether or not those would be available for you, such as MANT or CPI, in order to try and help keep that person safe as well as yourself safe.
Can you say what those initials mean?
Oh gosh. Okay, so they're both de-escalation trainings. I don't remember what they stand for, but if you Google CPI de-escalation training, it should come up. And same with MANT. Yeah. Crisis prevention interventions.
Do you know MANT?
Yeah, MANT's a longer one, and I received MANT training several years ago, and it was really helpful in having a plan and practicing and feeling like there were steps and strategies that I could use moving forward, and feeling like I was a little bit more empowered with some skills that I could use to keep the person safe as well as myself safe. So I can't do a presentation without talking about my brother. So this is a picture of my brother, Jonathan. He is currently 28 years old. He has autism, but he also has an intellectual disability, and he also has anxiety. And so one of the things that has been challenging in our family is dealing with his challenging behaviors, especially as he became an adolescent and a young adult. When he was much smaller, it was much easier to manage those big behaviors in a small body. He is now 6'2" and probably 240 pounds. And so he is not small in any sense of the imagination. And so when he initially started going through puberty, that's when we saw a big change in his behaviors, and it became very difficult for us to manage them. And my mom had spoken to the local police. They live in a small town in Wyoming, and said, if something happens and I call you, what will you do to help support us? And they said, well, we'll take him down. And my mom said, then I will never call you. And so they needed to figure out how they could build that relationship between local law enforcement to keep Jonathan safe, but also to feel like other people in the community could be safe too if he was escalating. And so the strategy that they first came up with was trying to build a positive relationship. The police had already been called to school a couple of times, so he was afraid of them. And so my mom started leaving little treats on their doorstep of things that he liked, and having the police come over for unexpected visits and saying, hey, Jonathan, I have a Coca-Cola for you and some French fries. And that was pretty cool to have a police officer show up with some treats. And so they started that relationship and building it in a positive way to try and set them off on the right foot and try to mitigate some of the damage that had already been done. And over the years, they've tried to continue to maintain that relationship. The police office in my parents' community, actually every year for Jonathan's birthday, have made cupcakes for him. And so he goes down there and gets a cupcake and has cupcakes with the law enforcement officers. When they have new officers that come into the district and jurisdiction, they let my mom know, and they set up a time for her to come in with Jonathan and do a little refresher course of his needs. And Jonathan talks about things that he likes and doesn't like. And it's really been a very positive way for them to build that relationship and for them all to feel confident in handling a difficult situation.
And I would say, that those are all really amazing steps that Lindsay's family has taken. With families that I work with as well, I really encourage them, even as a first step, just to introduce themselves to the local law enforcement and just let them know, right? Hey, we live at this address. I have a son. He has autism, and just want to make sure that you're aware of that in case you ever see him, walking down the street, especially, as they become young adults and adolescents, is really thinking about, I want to make sure that you recognize this individual in case they're running away, in case they're lost or confused. And so that's a really nice first step.
And some families that I know have taken actual information sheets down to the police station with their child's picture and has some information about them on it so that they can recognize them. It's important to refresh and revisit this conversation and those handouts, because pretty soon 5 years have gone by, and a 10-year-old does not look like they might when they're 15. The other thing that I think is important is to think about the plan if you're out of town and you need police assistance or EMS services, and what can you do with your local law enforcement to help you make a plan that would be helpful to communicate that information in an efficient way if you're not within your hometown or your local area. And then also thinking about other law enforcement or other agencies that you might encounter, such as campus police if they're on campus often, or military police or security guards in your building. And yes, Jonathan is the one in the middle with the green hat. Somebody made a comment about that. So another proactive strategy that we found really useful in our family is identification supports. You may have noticed in the picture previous that there was something hanging from Jonathan's neck, and our family kind of went back and forth on how we wanted to handle this, because we were literally putting a sign on him that said, "Please be patient, I have autism." And you can see it in the lower corner here. It's actually a passport carrier holder, and then we made that in the front, and then the back portion is his picture, some quick likes, dislikes, and contact information, allergies to medications and things like that. And then he keeps his state ID and some cash inside of his badge. Jonathan now will not leave the house without his badge most of the time, because he has noticed that people treat him differently when he has his badge on versus when they do not, or when he does not. And it has been really helpful for our family to communicate some quick information about him in a way that has facilitated better social interactions. Other families may not feel comfortable with something like that. Medical alert bracelets are a more discreet option. Other people, I think, have had, their child wearing a shirt that may imply that they have autism or that they have a developmental disability, or make other strategies that they feel comfortable with in doing so. One thing that I will say is that you might notice the red stop sign, and sometimes having signs like that on your home or in your vehicle in case there is an accident and you're unconscious or unresponsive, somebody is going to need to know how to support the individual that's in your vehicle or in that home if they're not able to communicate that efficiently. And this is scary stuff to think about, but this is why we think about these as proactive strategies to plan for. And then lastly, Project Lifesaver is what we have in Wyoming, and here it's Colorado Life Track. But these are GPS monitors that I believe you can get for free through local counties or for reduced costs, that can be helpful if you have an individual that does run away or elopes frequently. My brother has one. He does not know that it's intended for that. He thinks that it is a health monitor, because if he knew that that's how we found him, he wouldn't wear it. And so for his own safety, we have not told him, we have let him believe what he believes, that it's a heart rate monitor. So he wears it every day, and then the sheriff comes by and checks the batteries once a month to make sure that it's still working. And that is another way that relationship between him and local law enforcement has been reinforced in a positive way too.
You said that with that passport builder, that he saw that people treated him differently. Was it because he acted differently, or did he feel more secure when he had that on? Or?
Yeah, so we just had a question. We just had a question about Jonathan feeling like people were treating him differently when he was wearing the passport and his badge, and whether or not it was that he was behaving differently or if people were genuinely treating him differently. I'll say that from my personal observations, people tend to be, I would say, much more patient with him when he has it on. My brother, his kind of communication style is he likes to talk to everybody, and he has like a running list of questions that he wants to go through for everybody. And he just kind of approaches, starts to ask you questions, and then he's on to the next person. And he's a big guy. And so people are kind of taken aback, like, why is this, huge man talking to me about whether or not I've been to Disney World and if I know somebody named Olivia, and telling me Happy May. And when he has the badge on, I feel like people take more time with him and are more patient than if he doesn't. I haven't really noticed a change in his behavior so much. Great question. So another thing that Jamie and I had touched on a little bit is that because you have this time in your life where your role within your school, within your community is really changing and shifting, it's moving from more of a structured time to something that's more unstructured. And so often a thing that can help head off a lot of challenging behaviors is thinking about how to fill an individual's time in a meaningful way so that they can participate in their community and participate in work. We know from research that individuals with intellectual and developmental disabilities are drastically underemployed or unemployed. And so this can be really challenging, especially if you live in a rural area or you have limited access to resources. And so thinking about what activities are available and what are goals that that person is working on and how can you facilitate it within your home or your community can be a really nice way to try and think about things to help support an overall happy quality of life and head off a lot of those challenging behaviors. So these are some pictures of Jonathan doing some of the things that he likes to do. He went to the Night to Shine adult prom in Casper, so that's him in his top hat next to the limo. He has a little home business where he really likes to chop wood, and our yard looks like Edward Scissorhands went crazy on it, and all of our trees were, you know, devastated. And so my parents thought, you know, how could we funnel this into something productive for him? And so they made him a kindling business where they work with him to chop firewood and then sell it. And so there's a picture of him sewing some bags, I think, with one of his respite providers, and she's assisting him with that for that business. And then he volunteers at the food bank once a week, and he gets an opportunity to speak to people and ask them all the questions he wants to ask and participate in his community that way. And then he also likes to travel. And so he came down here to Denver and went to the Oktoberfest with us last year, and that's a picture of him with some of the folks there. And so thinking about how to support people so that they can do enjoyable activities and have meaningful participation is extremely important with this population.
And it's really important for addressing the mood concerns that Lindsay had touched on earlier. So things like anxiety, depression, we know that participation in community, that structure as well, is really, really important for helping with mood. And we know that in individuals with intellectual and developmental disabilities as well as individuals without disabilities. We also know from research that this community engagement and what we call adaptive skills or daily living skills are really strongest predictors of positive what's the word I'm looking for?
Future employment.
Yeah, future employment. Even when taking into account the level of intellectual disability or the level of severity of something like autism, we know that these are really, really important things to have in place.
So in thinking about other proactive strategies, it's helpful to think about how you can arrange that person's environment, how you can build those structures and routines, and then how you can use things that maybe are highly preferred to interest and motivate them. We all have things in our daily lives that we don't like to do, but just have to be done. And individuals that are that you're working with are also going to have things that they're going to have to do even though they don't want to do them. So one of the things for my brother is he loves his cats. He does not love the cat pans. And so trying to think about how can we balance the things that he really doesn't want to do in his day with the things that are really motivating for him, so that he is still engaging in those tasks and not able to avoid them just because he doesn't like them, and still have the fun things to do as well.
So these are some examples, again, of things. So right now we're talking all about things you can set up ahead of time, supports to put in place. So these are strategies that we know are effective as well. So warnings about upcoming transitions and expectations. A lot of individuals benefit from either a visual timer or if they're able to keep track of time, then saying, you know, at 6 p.m., we're going to do this. You have 10 minutes, you have 5 minutes. So that can be really helpful as well. And then also teaching coping or what we call calming strategies as well. So maybe they're individuals who deep breathing works for them, or listening to calming music, or coloring. And so these are examples, these two pictures on the bottom of kits or maybe calming bags or activities that individuals could use that we have ahead of time. And so we know when there's something coming up that might be really challenging for them, is they could choose one of these activities to do to help keep themselves calm.
And one thing that I'll add is that we always try to encourage people to use calming strategies when they need to be calm. And so the reason why we included this in the proactive intervention slide is because oftentimes these individuals don't necessarily have the skills to do that, and they need to be taught and reminded and rehearse those skills when they're, you know, down and feeling good and there aren't problems, so that when they start to escalate, they can access those skills much more readily. Oftentimes what we see too is that some of these coping kits and calming strategies don't necessarily change as the individual's interests change and as they age and develop. And so that's something important to think of too. And so you might notice that these are things that you might see any adolescent, you know, young lady have. And so thinking about how to balance calming and coping strategies in a way that is age appropriately and also accessible for those people in terms of what their abilities and preferences are.
So we have a question that what are in the bags? So there's some coloring books, there's some markers, a CD, I'm imagining, with either relaxing music or maybe some sort of meditation. I want to say that's nail polish. So maybe that's an activity. And then there's also I don't know what that's called. Is that like glitter in it? Yeah.
Yeah, like a sensory glitter tube, kind of like a little lava lamp.
A fidget spinner. Those are the kinds of things that are in there. Yeah.
And I think it's important to think about the individual's preferences and things that they would find helpful or calming, and you can experiment a little bit. I've worked with individuals that really like, you know, a specific scent, and so maybe they have some potpourri or, you know, some smelly markers or something like that in their calming bag, whereas that might not be a great fit for another person that has similar challenging behaviors.
And definitely highlighting what Lindsay said about, you know, when you really get to that point of high escalation, and we all experience this, like these strategies don't really work, right? So if you're like really, really, really angry, it's hard to be like, oh, let me just take a step back and color. So that's why we want to include these as kind of preventative stuff, because we really want to think about promoting you know, calmness and relaxation even before that event happens, because it's much harder even to access that tool if you don't even know how to do it when you're feeling calm.
So this is an example of a crisis kit. Backpacks or, you know, messenger bags are great for this sort of thing. And these are things that can be helpful to have as a go bag if things are going south. So having some coping tools in there, items that you might need if you're outside of the home. So if the individual maybe has diabetes and needs some food or access to some snacks in case their blood sugar drops, or medications, or extra clothes, IDs, insurance cards, copy of your crisis plan, what their medications are, and then of course a copy of consent to treat if you're not the legal guardian and you're going to be out in the community with that individual. Because if the police or EMS needs to intervene, this is going to help tremendously in easing that transition in that process to make sure that the individual gets the care and support that they need. So let's talk a little bit about crisis plans, because I've received quite a few questions in the past about what exactly is a crisis plan and how can you make it. And so a crisis plan in its simplest form is just what it sounds, a plan of action of what you're going to do if something goes wrong, and how the family, other care providers, and people that are in that individual's life would like you to help support them. It's really important to have that plan disseminated to all of those individuals, updated frequently and reviewed frequently. Oftentimes you'll have these beautiful plans, but a new provider comes on and it slips the mind of whoever might be in possession of that plan to share it, and then the plan's outdated, or that person hasn't had access to it, and then something that could have been prevented happens, unfortunately, when that person could have had tools that could have helped them in that situation. So it's really helpful to include individual needs and preferences, thinking about situations where that person is more likely to escalate, as well as what those cues are for that individual. And then thinking about how you can help support them at different levels. So if they're starting to escalate, what is the most effective that people that know that person best have used in either helping them stay at that level or pulling them back down so that they can access some other strategies and be able to prevent a blow up or more challenging behaviors. And then thinking about who to contact and how to utilize those people, and making sure that that information is current is also really helpful. There's nothing more frustrating than getting a wrong number or no number when you're trying to call in a crisis. So definitely make sure that that's covered. So this is an example of some of the things that are pulled from my brother's own plan. And this covers, the way that this is structured is it talks a little bit about what his skill set is, and then also where things start to be challenging for him, and then also how you can help direct him in the moment and things that you might notice. And so it's important when you're reviewing a plan like this to think about questions that you might raise if you're working with this individual. And so in looking at my brother's plan, it talks about under physical conditions, part of it says weapons should be secured and locked safe inside the garage or a secure place within the home. I've been known to seek out certain items as I'm running away, and my motivation for grabbing these items is not to harm others, but I believe that they will help me survive when I'm out in the woods. I may, however, use these items to posture towards a person if I'm upset with them, or to get attention from other people, or communicating that I'm upset. It is good to know that I will typically put the weapon down if I'm told clearly to do so. So it's important, I think, if you're walking into this situation to know, okay, so what constitutes as a weapon? Does this mean kitchen knives? Does this mean his hatchet for his kindling? Are there firearms in the home? Where are these things, and how do we need to make sure that they're secured? And how do we need to handle these situations that might be beyond the scope of what is detailed in this plan? And this is a sample template that Erica shared with us. And so this is something that can be helpful too in thinking about just trying to think of a good place to start for people that you might work with as well, and how to support them and what their needs might be. And so this is going to be included in the handout. It might be helpful if you don't have a template already in mind. And then this is an example of my brother's actual crisis intervention plan with preventative steps, law enforcement involvement, and EMS involvement. One thing that I think comes up often is, at least in our family, is that my brother's providers sometimes are reluctant to reach out to law enforcement, and they don't really know where that bright line is. And so we've found that it's really helpful to have that conversation early and often, that, if he starts to escalate, this is what you'll see. These are things if you can do. If that doesn't work, these are the medications you can administer. This is how you document that you had administered. If that doesn't work, this is what you do. And then having a clear point where they call the police, or communicating, we trust you. Please call the police if when in doubt, we have a positive relationship with them, and we want to make sure that they can feel safe, and that you feel safe in that situation as well.
So there are a few other things to keep in mind for either including in crisis plans or when we're thinking about the environment. Sensory stimuli is a big thing for a lot of these individuals, and I see a lot of head nods. So we think about many individuals, not just with autism, but with intellectual or developmental disability who don't have autism, have sensitivity to sensory stimuli. So maybe certain lights, smells, tones of voice might impact them differently than they may impact us. And so we want to think about that stuff, and we want to think about if we can modify the environment. Again, thinking about preparing ahead of time, but also, if you're needing to go to a loud place, and this is an individual who really has difficulty in loud spaces, could you have headphones? Could that be something included in the crisis kit that they could use in case it's needed? And sometimes it might not be observable to others, and they might have difficulty communicating what's bothering them, but really thinking about, could it be the clothing that they're wearing? And so thinking about that these are all reasons we might see challenging behaviors, and also things to consider in communicating with other individuals as well. Medical issues are also a big one. We talk a lot about sleep in our field, and we know that sleep disturbances, I'm sure any of you can relate that when you haven't slept well, you just don't feel right the next day. And so disruptive behaviors, challenging behaviors, irritability, that could certainly be a result of poor sleep. And so it's something we always want to consider with individuals. Also, though, seizures, things like constipation, dental problems. When I was previously working in a hospital, we saw quite a few individuals who were in the hospital. They ended up in an inpatient unit for what we would call like physical escalating behaviors, and realized that they actually had a toothache. And that's really why we were seeing that. So we always do want to rule out any medical reasons for any of these behaviors that we're seeing, especially if they are out of the ordinary or if they seem really extreme. It might be that there's something going on inside the body that we can't see that's really making it challenging, and it's hard for them to communicate that. And also as providers, really thinking about, and parents, that monitoring physical health is really important, especially for an individual who has difficulty communicating about what they're experiencing physically.
And I'll just say that even if an individual can shower independently and does really well with their own personal hygiene, I would still recommend thinking about doing physical checks of their body. Mm-hmm. I've worked with an individual that was very capable of doing all of those things, and unfortunately it was discovered quite a bit later that he had a tumor the size of a softball in one of his testicles that he wasn't able to communicate to us, and we were unaware of because he did his toileting and all of those other things independently. And so fortunately it was very treatable and he's fine, but thinking about doing physical checks and making sure you're monitoring their physical health is extremely important, even if they're independent in a lot of other ways.
Mm-hmm. And that can be something for a doctor's visit as well, certainly. Mm-hmm. And so we're really thinking about learning the triggers for individuals. So that's really a big step that we take, is thinking about what sets this person off. And so the best way to do that is really to talk to parents, talk to teachers, talk to providers, ask the individual. I mean, a lot of times, we see that there's an assumption that the individual might not be able to communicate, but a lot of times that they can, and they can explain to you what's going on or what's bothering them. And it might be something that we really weren't thinking of. Again, like, my jeans are really itchy. And that might be the last thing you're thinking of in that situation. And so really, ask them, use a plan of care and other documents to guide you, gather information from all other individuals. As psychologists, that's something we always try to do, is really work with all of the providers involved so that we're not seeing an individual in isolation. And then remember to document everything. So you're documenting it for other providers, you're documenting it for yourself. And so we can't emphasize that enough, is making sure that you're documenting these things. Yeah. We know consistency is key as well. So one of the ways that we could reduce surprises is by using visual schedules. I always tell parents and providers this does not have to be fancy. So yes, you can go to Walmart and they have those dry erase boards with the magnets. You can certainly do that. But sometimes for my parents that I'm working with, what it takes is pulling out a piece of paper and a pen and writing down or drawing a picture of the 5 things that are going to happen. And this just really eases anxiety around a new situation, around something that might be challenging for them. So you're basically creating structure even within an unstructured environment. So I mentioned that I had done some work in hospitals, and one thing that we saw often with individuals with intellectual and developmental disability is that it was very challenging for them, as you can imagine, to be staying in the hospital, whether they were in a medical unit or a psychiatric inpatient unit. And so one of the very first things we do is we think about how can we create consistency within this unstructured day. So things like shift changes, those happen. And so as much, even if we can't prepare them for exactly who's coming next, at least knowing that a shift change will happen and when it's going to happen, whether it's through the residential facility shift change or if it's a change in nursing care, those things can be really helpful. And as much as we can use visuals as well. So maybe when the new person comes, they get a picture of who's coming and a reminder of the thing that they like to do with that individual. And so these are some examples of different visual supports that might be helpful. So calendars, plans for the day, you could either do it in a daily. Some individuals even need it broken down by tasks. So maybe a monthly calendar is too overwhelming, but having a list of the activities that they need to do could be helpful. So I always say, something like clean your room. Well, that could mean something very different to me than it can mean to you. And so what are the steps that are actually involved in cleaning your room, and having those steps clearly with pictures and words shown, and those are the steps the individual knows they need to take.
And one thing that I'll add too is that a visual schedule or a visual support is only as useful as it's being used. Mm-hmm. And so if it's not meaningful for the individual and it's not being utilized by them, then you need to go back to the drawing board. And I think oftentimes what we see is that either visual supports don't match the level of that person's cognitive abilities or their communication skills, or that they're not even thinking to look at them and utilize them to their fullest. And so all of us use reminders and schedules and things like that in our day-to-day lives. There's apps that can be used for teenagers and young adults. There's planners. There's some things that are very low tech, like what Jamie was talking about. It's all about thinking about what's going to be the most meaningful and the best fit for this person. Several of you may have heard of social stories, and we kind of touched on this too in thinking about how to prepare somebody for maybe an unknown situation. Just for the sake of time, we're not going to talk a lot about social stories, but they're pretty easy to write yourself, and then there's also some that are available online. This just goes over some different things to keep in mind if you're trying to write a social story yourself and what information is most relevant to include. Oftentimes, this is another thing that you use to plan ahead. Mm-hmm. You can leave these in the car. You can use them and review them at a person's home. Some waiting rooms will have them to go over with patients as far as what a dentist visit is like, or a gynecological exam, or some of those other things that might be pretty foreign for that person. And so here's an example of one that is a little bit more sophisticated, that has more words that are added about going to a wedding. So you can use something like this if the individual is a good reader and just needs a little bit of preparation as far as what to expect. And then there's examples like this that are a little bit more simplistic, that have simpler words and more pictures, that might also be a good fit for an adolescent or a young adult. It's all about thinking about what information needs to be conveyed and the most appropriate way to convey that based on that individual. So revisiting our example, earlier we talked about Sharon, who, as you guys may remember, she wanted to go out for coffee, but her staff said, you can't, you don't have enough money. And she started scratching herself, yelling, throwing items at the staff, and then the staff left the room. So thinking about that, what are some skills that Sharon needs to learn given this recent incident? What skills is she lacking in order to cope with a situation like that? And what proactive strategies, now that we've reviewed those, could have been helpful in thinking about this example with Sharon?
Being able to manage your emotions.
So
maybe something that would have been helpful is just some a warning ahead of time to kind of talk to her about, going out and having coffee, or maybe there was something else that we do.
Nice.
So for the people that are online, one of the suggestions in the room is possibly giving a warning to talk and prefacing this conversation with her. And she has some difficulties with emotion regulation and needs some help with that in light of this recent incident. Any others? Some other things that Jamie and I had thought of is, coping with disappointment and handling that, as well as emotion regulation, and then thinking about communicating. Maybe she wasn't able to say, that's a real bummer, or I'm really let down by that, or I was looking forward to that. Some other proactive strategies that you can think of is if you know that a person is likely to scratch themselves, clip their fingernails, keep their fingernails very short. If it's a high-risk time, maybe they should wear gloves. If it's something that is a chronic issue and really affects their quality of life and their health care. And then also thinking about alternatives that you can give her. Sometimes what we see is if there's limited communication abilities or struggles that are prevalent, you just said no, so they may not know that there could be another time where I could go out for coffee. So thinking about how you could have modified that. So maybe saying you're unable to go out for coffee right now, but maybe what we can do is on Saturday we can go out for coffee, and using a visual support or a calendar so you know that that person knows when Saturday is. Or giving an alternative like, I know that that's really disappointing, but we could make coffee here at the house instead. Yeah.
So Shelly online had an idea counting her money with her so she can see there isn't enough instead of being told she doesn't have enough money.
Yeah, that's a really great idea. And I would go even a step further of maybe even having a visual support showing like how much she needs. And then showing how much she has so she can really see that difference, and then keeping in mind like how might she earn more that she needs, or when might that be that she'd be able to have that. That's a really great idea. Thanks for that input.
And then, of course, practicing coping strategies prior to that, so that if you notice that maybe she, started to pull her hand up to her face and was looking tense or tensing her muscles, then you could say, oh, I'm noticing that you're looking really stressed out, and, maybe we should go listen to some calming music, or let's go take a bubble bath, or whatever it is that could be helpful for that person at that time.
So these are all preventative, right? But we also know that there are times that it just doesn't work, right? So we have everything in place. We've got the visual schedules, we know their triggers, we have everything. And this says plan A failed. Thank goodness there are another 25 letters in the alphabet, because sometimes it just doesn't work. And we recognize that we also need to have a plan for when we get to that point that there is nothing, we feel like there's nothing we can do.
So this this came from the Crisis Resource Guide. That is something that's being developed here. It's currently it's currently online, correct? But it may not always be online. And so you can Google these ladies' names as well as Crisis Resource Guide, and they have some really nice suggestions. Oh, it's in the suggestion. It's in the handouts. But the Crisis Resource Guide in its totality is a really nice resource and goes through some different things that you can do. This is just an example of a decision tree that could be a nice visual to include for yourself. And that just kind of goes back to what we were talking about when it comes to planning. When we're thinking about when a person is actually escalated, one of the big things that goes out the window is communication. And if we think about us at our worst, when we're really having our own meltdowns or our own crises, if somebody were to give you a really complex task and say, you know, I know that you're losing it right now, but I need you to complete your W-2, you're not going to be able to do that. And for some of these individuals, communication is that challenging. And so we need to think about how to manage your own affect and tone and how to communicate with a person that is at that level that's going to be meaningful for them. And just remembering that even if they are highly verbal, that doesn't necessarily mean that they're able to access those communication skills all of the time. And I think that the big thing that Jamie and I would also emphasize is that when a person is escalated and they are at their peak, safety is the top priority. And so thinking about how to maintain safety, this wouldn't be the time to process what happened, to ask them why they're behaving the way that they are, or to try and scold them for their behavior. This would be the time to maintain safety and try to help bring them down and support them in that way.
Yeah, so I mean, this is similar to what you said, is having an idea of safe places and supports given your location. So thinking about what can you do if the behavior difficulties arise at the grocery store or at their home or in a moving vehicle. And then just keeping in mind that property is replaceable, people are not. And so if you really are in a place that's unsafe, is getting out. And that might very well be the case. So in addition to managing behaviors in this way, we also really like to think about positive reinforcement. So we like to think about rewarding individuals for desirable behaviors. And so we want to do this. We think about doing this throughout the day. It could be small ways to do it. But we want to, again, I think of that example of like clean your room might be a really difficult task, but like put the dishes in the dishwasher, like great, that's a task we can do. And so making sure that we're rewarding those positive small behaviors that are attainable goals rather than expecting these larger goals as well. And trying to think about when might the individual need a break. So there are a lot of individuals with intellectual and developmental disability who we kind of think about different zones of frustration, and maybe it's harder for them to kind of recognize that they're starting to feel frustrated and then they get to that point of escalation. And so if that's an individual that you notice and maybe you realize that doing chores around the home is something that usually triggers that, is thinking about how can I implement breaks for you and help you understand and kind of put those supports in place ahead of time, even if you're not saying and requesting that you need a break, because we know that we all need breaks throughout the day as well.
And one thing that I'll say is that sometimes with teenagers or young adults that are pretty socially savvy, sometimes they don't want to take an out because of their environment and how that might appear. And so thinking about discrete ways to implement those breaks is sometimes helpful, and thinking about, can they pass you a note? If they, stand up and give you, a thumbs down, does that mean that they're just leaving the area for a little while? And thinking about how you can support that person and give them a safe place where they can decompress if that's what fits for that person.
And then we also want to think about if there are small acts, trying to ignore if we can. We're not promoting that if an individual hits you that you just let them hit you, right? But we really want to think about, in the grand scheme of things, the more that we can kind of shape these positive behaviors and try to ignore some of the smaller, minor negative behaviors is really kind of the approach that we want to take. We want to try to avoid ending the task. Again, if it's a safety concern, absolutely stop, get out, whatever you need to do in that moment, a safety for you or for the individual you're working with. But if someone displays challenging behavior because they don't want to do something, and then they don't have to do it, then in that moment they've learned, right, if I hit, I don't have to do what I don't want to do. And so we really want to make sure that escape is not the answer if possible, and to try to think about other things as well. We also, again, in those moments, want to reinforce any positive behavior we're seeing. So if they become, safe hands or quiet voice, you might say, I really like how you're using safe hands. Some individuals that I worked with, however, your voice can actually even escalate them. So saying like, I really like the way you're using your safe hands might even make them more angry. So in that moment, they might really truly need, and I've done this with a timer of, I'm going to give you 3 minutes to cool down. And so maybe it is taking a step away and decompressing on their own, provided that they're remaining safe.
And I was going to add too that sometimes it's the individual, and you need to switch out. And so maybe it's that they're really frustrated with you, but another provider or a caregiver can step in and is going to be more successful at bringing them down. And that doesn't reflect poorly on you and your abilities, but sometimes you just need to have a transition in order to do that. And I would also say, if you do need to physically assist a person, if they're being unsafe, communicating to that person that you're going to be touching them or you're going to physically assist them is really important too. MANT, CPI, and some of those other trainings go over how to do that in a safe way, and that would be something to talk about in a crisis plan and in the context of a care plan as well.
And I would add, it might not just be that the individual is frustrated with you. We're human, and it might be that in that moment we are feeling really frustrated, and that we're at the level that we can't manage the behavior either. And so if there is another provider who can step in that moment, we absolutely encourage you to do so, and understand and recognize that in that moment you're being a better provider by taking a break for yourself, and allowing someone else to step in than trying to handle it in the moment when you're really not in the place that you can handle it. We also really encourage making notes about ABCs, often give families an ABC chart when first start working with them. And sometimes even just charting it can really help you understand the why and use this to inform the next interaction. So if you start to notice that there's certain times of day or certain antecedents or consequences that are surrounding a behavior, that's a really good starting point for learning how to shape that behavior as well.
So just quickly on the example of Sharon again, thinking about behavioral strategies or interventions that could have been helpful in that moment with Sharon. So some of the things that we've talked about is noticing those signs of escalation. Is this a known trigger, being denied access to something that she really likes, and thinking about how we can support and apply some of those coping strategies before she gets to the point where she's totally escalated. And then also, how can we maintain her safety in that moment? Is it best for her safety for that staff member to leave the room, or is that something that is not going to be a safe situation? And so thinking about how are you going to be able to monitor that person and keep her safe or him safe given the context of their behavior and what we know about that individual.
So for the interest of time, I know a lot of people had questions also about managing sexual behaviors as well. So I think we'll jump into that. And then at the end, if there's more questions around some of this challenging behavior, we're certainly more than happy to address it if we haven't already. So let's talk about sex, everyone's favorite and least favorite topic, right? And so we're going to talk about sexual behaviors more so than sexuality. If anyone's interested, can certainly give you some resources on sexuality in individuals with intellectual and developmental disability, but really want to start with talking about sexual behaviors.
So this often comes up of why do we need to talk about this in the first place? And unfortunately, what we know from the research is that this population is much more likely to have contact with the criminal justice system and also to be victims of assault or sexual abuse or victimization. And so it's really important to think about how can we help support a person and arm them with tools to keep them safe and to keep them healthy, given what their level of need is.
And I would say victims as well as perpetrators,
True.
because of lack of knowledge of kind of the social boundaries as well. Yeah.
So some things that I think are really striking to think about is that women with developmental disabilities are 7 to 9 times less to have a pap smear at any point in time in their life. And because there is oftentimes very little sex ed that happens, they are more likely to contract STDs, to not know about contraceptive methods and not use them correctly. Oftentimes these are students that are opted out of sex ed classes. Sometimes parents make that decision and sometimes it's just made for them. And so thinking about how to facilitate that learning in a way that's meaningful for that person is really important, because we know that abstinence can only go a certain degree of the way. We need to think about when abstinence doesn't happen, or if this person is victimized, how they can be healthy and how they can be safe.
There's also really little emphasis on social basis in sex education classes. And if we really think about the majority of where you learn information, I often do this activity is, really think about where did you learn most of what you learned about sex and sexual behaviors. It's not from your teacher in 5th grade, right? It's from your peers. It's from the media. And so that's a piece of this too, is that the classes often don't contain that social piece that's really important to understand. So even if you might know the fact behind a sexual behavior, the context and how to navigate that within a social environment, that's what's often missing.
And we often know that this population in general has challenges in social settings and with peers that are similar to them. And so they may not be able to access that information, or they may be accessing really incorrect information. So some of the reasons why we don't talk about this often is, first of all, the infantilization of individuals with disabilities. So this is the idea that because they have a disability, they don't have sexual desires and urges, or they're not sexually mature individuals. And then also there's often an assumption of sexuality, and I've seen often a belief that either a person is asexual and not interested at all in sex, or that they're automatically heterosexual. Which may not be the case either. And so thinking about those things, it makes it really difficult for people to want to broach these topics and know how to broach these topics. And so there's a lot of confusion about who should teach it, what they should teach, and how they should teach it in the context of cultural beliefs, or fear of, what if I give them ideas that they're going to do something inappropriate, and it's just uncomfortable for most of us to talk about these things, especially with an individual that may ask us questions that are quite pointed, or we may not know the answers to. So in thinking about this, some of the things that are helpful to consider in thinking about how to have these conversations is preferences for not only their family, but the individual as well, if they are able to make that decision in handling challenging behaviors related to sexuality and sex ed. And then also determining how much information is appropriate to share and what do they really need to know. And so in working with some of the people that I've worked with, and in my own family, we don't have to deal with very many challenging sexual behaviors in my own personal life. And so when my brother was going through puberty, it was an issue of showing him pictures. My dad took him into the bathroom and had it like a show and tell and a discussion about, this is, your body, this is why you have hair. And that was sufficient for him at that time. But if that changes, then those conversations have to be revisited. And then also thinking about intersecting identities, such as sexual orientation or religious and cultural beliefs, and how that fits into those individual preferences. And then the other thing that I would add is medical needs, and thinking about if there are medical things that are getting in the way, or medical things that should be considered in thinking about sexuality and sex ed, and how to navigate that. And doctors and other medical providers are often really great resources for thinking about how can I teach this person this in light of what their challenges or needs might be.
So when we think about what to teach, we think about the facts. So as Lindsay said, for her brother, it was a show and tell and an understanding of what, what changes might happen in the body. What do you need to do for personal hygiene? I mean, there's areas you need to clean that are a little bit different as you get older, or you may need to be a little more careful. Facts about boundaries and touch, about how to express affection, who to express these different ways of affection with. Exploitation prevention is key. Can't emphasize enough the importance of both the victimization, but also victimizing others as well, even if the intent was not there. Dating is really important. Teaching terms that aren't just the proper terms, but what are they really going to hear from other individuals, from movies. And at the end, I'll show you, there's a really nice book, and it literally has the word penis, and there's slang terms for it, and there's proper terms for it. And each time I still learn a new word as I go through it. So that can be really helpful as well. And then it can't emphasize enough the social aspects of this. So oftentimes they might understand the facts, but don't understand those facts within the context of that social context. So not just what to do, what not to do, and why. So we really want to think about big ideas as well. This concept of private place versus public place is huge, and thinking about a lot of these different behaviors. And so a private place is where no one can see you. A public place is where anyone can go. And so even going as far as a private place is the bathroom in my home with the door closed. And really making sure that there's boundaries for privacy within the home, thinking about things like knocking on the door, discussing how privacy is defined, and really setting up those rules. So this is a nice visual example that I've used before of what areas of the body can be touched where. So my genitals or my private areas I can touch in my bedroom with the door closed, or in my bathroom at home. And it goes down to things that you might be able to do everywhere. And so thinking about different strategies that might be helpful. And if you do see an inappropriate behavior occur within the home, in that moment explaining why it's inappropriate and where maybe they could do it that'd be a more appropriate place. So some of the strategies we recommend: using images, videos. Again, as you probably can tell, we really are big in visuals, because having visual supports is much better than just trying to interpret all of the language. That's why we have a PowerPoint presentation and don't just stand up here and talk. Also thinking about TV and films can be helpful, not just like here's an appropriate thing that happened, but also like let's watch this video clip from this movie and talk about why this wasn't appropriate, or why did that person react in that way. Use a lot of vignettes as well, and so maybe an example of, Sally and Mark are coworkers and here's the situation. I will say in my own experience in teaching groups to this age group on sex education, they can often understand what's wrong in a situation, but have a lot of difficulty understanding what's wrong about their behavior in a similar situation. And so role-playing can be really powerful, and role-playing more of the social pieces of it. So if Lindsay and I are role-playing, having a conversation, helping Lindsay understand what about my behavior is showing her that I am or that I'm not interested in continuing in this interaction. And so that can be a really powerful tool in really teaching those social pieces that are often difficult to interpret. So my body language, my facial expressions, what can you do in that moment? It can be really hard to say no, and it can be really hard to discontinue an interaction that you're not interested in staying in the interaction. And so how can we, practice that? So I'm talking to Lindsay and she's not interested anymore. How could she stop that conversation? And so that's where role playing can be really helpful.
And videotaping those role plays can be a nice way to review that with that individual too, so that they can physically see those behaviors.
This is another, we can go to the next one. This is another example of something that might be helpful to use. We call it, circles of relationships. And so thinking about the inner circle is maybe who you can be most intimate with and what that intimacy might mean. And then circling out. And for some individuals, it might even be as concrete as like kissing goes in this circle and here are the people I can kiss. But I have to ask them if they want to kiss first. And so really going through those rules as well. We want to make sure that we address masturbation because I think this is a big thing for this population. It's also something that people don't like to talk about. So hopefully we'll make you uncomfortable here, or those of you at home, so then you feel more comfortable with this topic. So masturbation for us, we consider it problematic if it's occurring in public, if it's interfering with daily functioning, and if it's upsetting. So if there really is a problematic masturbation, we would encourage to do a behavior analysis and really figure out if there's any changes that need to be made. And so that might be a case where you get some outside support or consultation. But otherwise, we're going to talk about some strategies that you could use if it's not considered problematic and that it's, interfering or in public or upsetting. So really important to differentiate between public and private spaces. And you can become pretty creative with this as well. I've gone so far as to have visual signs, like a red sign means no, a green sign means yes. And if there's a green dot on the door, that means this is a place that I can masturbate. And so it might be that it's in my own house with the door closed, right? I've also worked with adults and adolescents that we've had a visual cue, so a specific pillow that they use. Make sure you're washing the pillow or any other thing that you're using. So that might be a strategy that might be helpful as well. Using terminology that they understand. So maybe it's private touching, or it's their private relaxing time, whatever it is that makes sense for them, and to trying to keep a positive attitude about appropriate masturbation and not being punitive when it is occurring is something that we would encourage.
So remember that oftentimes we get asked, how much is too much in terms of masturbation. And so really the two rules would be to think about whether or not they're hurting themselves or it's interfering with their other daily tasks. Or if it's, really distressing to that individual, like Jamie mentioned before. And so other things that you can do to intervene if you do feel like it is too much is to think about other techniques to self-soothe. This can be really challenging because very little is as pleasurable and can match what masturbation brings to most people. And so thinking about what are some strategies that you can use as replacement behavior instead of just saying don't do that. Mm-hmm. And then also ruling out medical causes or thinking about if they're using inappropriate techniques or using inappropriate materials and what you can do to help them be able to use more appropriate things to facilitate healthy masturbation, as well as increasing other non-sexual activities that can be pleasurable also.
We want to make sure that we also cover internet safety, media portrayal of sex. It's something just to really think about. For some individuals, it might be as far as setting up firewalls to block inappropriate sites, removing access to Wi-Fi if necessary. But for a lot of these adults, they are adults. So even if they're having, we talked about not treating as children, they may have cognitive abilities much younger, but physical feelings and physical parts that match their age. And so really what we want to think about is communicating openly about these different topics that are hard to talk about. When you're seeing something in the media, like what does that mean? And what does that really look like? And just because you saw a video where this person did it, let's talk about what those real implications are, and what you really could do instead. And then thinking about, in this, today, online dating, meeting friends online is huge. And that's okay, but we really, really want to encourage safety around friends online. So where are appropriate places to meet people for the first time if you've never met them before? Like, do we think that going at midnight to like someone's house is a safe decision? Probably not. And so those are things to think about as well.
So in thinking about consent as well and avoiding danger, we want to think about who should be discussing certain topics. So is it the parents that are going to do that? Is their healthcare professional? Is it a therapist that they're seeing? And who needs to be present for those conversations, and what information needs to be disseminated? And then also encouraging and modeling healthy assertiveness, boundaries, and safety, and then creating a plan with that individual. So having some visual supports. Here are a few that we found that can be helpful to use, that can be a nice way to practice and discuss what that could be. Talking about things like, nobody should be touching you where your bathing suit covers, if it's a person that needs that level of support and intervention, unless it's, a doctor or there's a medical reason that's there, and then explaining when that's going to happen. Do you want to talk about legal issues at all?
In the interest of time, I think we should probably.
Okay.
Yeah.
And it's just important too, I think Jamie touched on this in terms of thinking about media safety and online safety. Some people need monitoring and checking in. Things like stalking or pornography or sending explicit text messages to individuals is a common issue that we see. And so how can you help educate and correct those behaviors and then monitor for safety as well? So there's several different curriculums out there, luckily. These are some great resources that we would recommend for people to look at. The resources that are towards the bottom are free websites that have a lot of really nice materials that you can access. The first one in particular at mass.gov has a list of different books and videos, and then tells what ages or what populations they're most appropriate for. And so this could be something that could be really useful depending on the types of individuals that you work with and the information that you feel like you may need to talk about in regards to sex ed.
Yeah, so we just have a few minutes left, and I just want to make sure we leave time for any questions that people might have, either here or through the web.
And yeah, I was just gonna say, of course, if questions come up later too, this is our contact information. And so we'll hang out for a little while in case folks do have some questions, and we'd be happy to answer them. But if later on you have a question that comes up, please feel free to send us an email.
No questions? This is super clear.
Everybody knows everything they must need to know about sex.
Yeah. All right.
Great.
Alrighty. Sorry.
Go for it. All right, I just wanted to say a thank you for everybody who's here in person and everybody who's joined us by live webinar also. As I mentioned at the start, this webinar will be recorded. It will be available with all of the slides, with the resources that were mentioned in this, and a discussion and behavior guide on the Easterseals website, on the Colorado Respite Coalition website, and on the JFK Partners website if anybody would like a refresher. Thanks so much for being with us today, and have a great rest of your morning.